Good afternoon, students. This is Dr. Elizabeth Paul, and I'd like to welcome you to this presentation entitled Making a Difference in Global Health. And today I'd like to discuss with you a couple of different points. First of all, I'd like to define what is global public health. I'd like to share with you how I developed my passion for global health. I'd love to detail some global public health opportunities in and around Jacksonville, and I'd love to share with you some ideas of how you might get involved with global public health in your area. So first of all, let's focus on global health. What is global health? What actually does that mean? The formal definition of global health is the health of populations in a global context. It's been defined as, open quote, the area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide, end quote. Problems that transcend national borders or have a global political and economic impact are often emphasized. Thus, global health is about worldwide health improvement, reduction of disparities, and protection against global threats that disregard national borders. Global health is not to be confused with international health, which is defined as the branch of public health focusing on developing nations and foreign aid efforts by industrialized countries. And that's something that I wanted to make sure that you were clear, the difference between international health and global health. And this course is really going to focus on global health, focusing on improving health and equity for all people worldwide. Global health issues are also local issues. Their problems are our problems, and our problems are their problems. We are all interconnected all around the world. So an example of what their issues may be, for instance, Ebola in Africa, dengue fever, refugees seeking better lives in Syria, in Iraq, and wherever they may be, tuberculosis, overpopulation challenges, and our issues, meaning more the developed countries, our challenges focus on reforestation, water stress, like we're all experiencing here in Florida and in California, climate change, among many. So their issues impact our issues, and our issues impact their issues, and we'll talk about that now. So for instance, looking at Ebola, it developed in Africa and it quickly spread to the United States. Within a plane ride, we had it here. Very, very quick. There was a dengue fever outbreak in India that occurred last October, and how quickly these things a mosquito can transfer over from one place to another. It's very, very easy for this to occur. Refugee health issues, as we're all aware, we've had the largest resurgence of refugees since World War II. They're issues that impact the entire globe. Many refugees actually end up dying in their escape. They never make it to freedom, as we've all experienced and read in the news. Another issue that focuses on a big issue around the world is female oppression, which is rampant in the developing world. As you can see, this clip from Malala and her fight to receive an education. In the lower left-hand corner, looking at the acid attacks in areas such as Pakistan, and another example in Pakistan, a woman getting stoned to death by her family. Climate change is another huge challenge that's impacting the globe. March 2017 was our hottest month on record, and it seems that every month we're achieving record after record after record. It's getting hotter and hotter and hotter. How and where did this occur? Another challenge that is affecting the world and also affecting us is pollution. Here's an example of Chinese pollution that has drifted across the Pacific to the western US. A huge, huge challenge that we're impacted with. So anyway, global issues are our issues are their issues. We're all interconnected around the globe. So now let's take a look at how I developed my passion for global health. So I wanted to give you a quick overview of my background. I'll go through each of these in a moment, but I'll share with you, first of all, I spent 4 years working in Thailand in various capacities. I then left and pursued a master's and doctoral degree at Columbia University, where I also was an adjunct assistant professor. I started and formulated a non-for-profit 501c3 organization called the Adolescent Health Alliance. Then I moved to serve as vice president of a small consulting firm called National Health Promotion Associates, followed by working at Pfizer on the business side. And I have a number of areas of my own expertise: global health, refugee health, managed care, maternal and child health, program development, evaluation, new business development, fundraising, and so many others. But let me go through a couple of these now. Started off when I was very young, when I was 6. I've always wanted to try to make a difference in the world, and I really wanted to do something that would help or impact at least one other person in the world. And so when I was 6, we had a family. They were called Boat People, a family from Laos, come to our community, and our church took them in. And because I was so shy, I was selected as the person in my class to befriend this young girl named Rasame and introduce her to American culture. I loved their culture and ended up learning a great deal about Laos and Southeast Asia, and loved the fact that our community really took in this family, and this family became incredibly successful. They had 5 daughters, and all 5 have done something remarkable to impact the world. Anyway, this was my motivating moment. I wanted to do something to give back to the world. So I started saving at 6 years old, and I actually used the dollars that I saved to fund my 4 years in Thailand. After graduating from college, I was accepted into a program called World Teach with I was actually starting the program in Thailand, in northern Thailand, in Chiang Mai. Loved it and stayed for 4 years, and also worked in a refugee camp. I started off in Thailand in Chiang Mai, which is, you can see the circle in purple, the upper north western part of the country, Chiang Mai. You can see Bangkok in the middle in green. I lived in Chiang Mai for 2 years. I worked in World Teach as a teacher in a Buddhist college, and the picture in the lower right-hand corner is the front of my school, and that says in Thai characters, Rajamwala Institute of Technology, the Lana campus, and that's where I worked for 2 years. It was really exciting. And I also developed a new World Teach volunteer orientation program, and I taught them Thai culture and language, and developed a program for World Teach volunteers going forward, which is really fun. Chiang Mai is a beautiful city. It's called the Land of Temples. These are a few of the temples. This is my favorite temple. This is at the top of a mountain. I lived at the bottom of the mountain. It's called Doi Sutet, which means the Cloud Temple. It was absolutely gorgeous. On the weekends and on school breaks, I joined relief humanitarian trips to provide assistance to the hill tribe populations in northern Thailand. And we joined these multidisciplinary teams with architects, nurses, public health professionals, and doctors. And our goals were to either provide basic first aid, if we had primarily nurses and physicians with us, or we would build and repair schools if we didn't have any health professionals. So it was really exciting. And these are some pictures of various Hmong populations. On the upper right-hand corner are their homes that are made. We stayed in the homes. They're gorgeous, built right on the side of the mountains. They're gorgeous. No running water, electricity, but fabulous place to live. Then I got a job of a lifetime working in an Indochinese refugee camp in Phanat Nikhom, which was about 12 hours south of Chiang Mai, about 4 hours southeast of Bangkok. You can see it's circled in purple, the area. The largest city near there is called Chonburi. I worked in a small Chinese Thai village called Phanat Nikhom, and we would bus to the refugee camp about 30 minutes each way. We could not stay in the refugee camp. I have some pictures from the camp experience. The refugee camp which I worked was the last camp that the refugees would live in prior to resettlement in their third country. And in the camp, they would learn English and work orientation and cultural orientation skills. There were about 20,000 refugees in this camp. Many were refugees from the Vietnam War and from the Cambodian Pol Pot regime. They were survivors. My focus was maternal and child health care. And these are some of my students. I also taught science, and these were some of my teen students. Most refugees I mentioned were from Laos, Cambodia, and Vietnam. These are some of them here. They were beautiful. Refugee homes were basic. They were meant to be temporary, and I'll explain this later in another lecture, later in the course. But these are homes here. You can see they're made of, they're very simple, made of a pressed, some type of an asbestos type of material. There's no privacy. That big urn in the middle is where many, many families would have to get their water sources and bathe out in the public. Fresh water, as you can imagine, was always an issue. There was constant flooding. The availability of clean water was a challenge for absolutely everyone. And you can imagine what thrives in the dirty water. The picture on the lower right-hand corner, you see some children. They were playing. That's actually an open drain, a raw sewage drain, and the children were playing in the drain of filthy, filthy water. And as you can imagine, I learned much more from my maternal and child health students than they learned from me. You can see I have 3 of my classes here. I always took a picture with each of my students with each class, because they were just all so different and so memorable. And these were 3 of my classes. There were many different ethnic groups within the camp, and they were encouraged to share culturally unique pieces about their culture. And in the lower left-hand corner, you can see me dressed up as in a Hmong wedding dress. And I'll tell you this story later in the year, but this picture that I have about 40 rags tied around my middle, because for the Hmong culture, the larger you are, the healthier you are, the more beautiful you are. So they kept wrapping and wrapping and wrapping. Can't say I look too nice in that picture, but it was a fun experience. I worked with students of all ages. This was an art class I taught with 5- and 6-year-olds. And the children were very, very hard to leave. You can see the siblings, they all take care of each other. They used to follow me around and just kind of wander around because there wasn't much to do for the younger ones. After 4 years, I left Thailand and started my master's and doctoral degrees at Columbia University with the intention of returning to Thailand again once I finished my degrees. I received my master in public health from Columbia School of Public Health, and then I got my doctorate from Columbia's Teachers College, and then I served as an adjunct assistant professor at Columbia for about 7 years. While a graduate student at Columbia, I volunteered with the March of Dimes in New York City, and I created for a class assignment a maternal and child health program that I really wanted to implement in real. I thought it was a good program. I had it was a design, implementation, evaluation of a pregnancy prevention program, and so they helped me to implement this within Harlem in a settlement health clinic on 103rd Street in East Harlem. And it was a huge success. And I kept working with this settlement health clinic, developing more and more programs. And that's how my 501c3 started, the Adolescent Health Alliance, which was really excited. It became a peer-facilitated health intervention program targeting inner-city youth to develop and foster self-esteem and positive decision-making. And I worked with one of my colleagues to develop, as I mentioned, pregnancy prevention program, a program targeting STDs, drug and alcohol prevention, domestic violence, and we also worked with the children of domestic violence victims. And we implement these in the settlement health clinic and a number of other health clinics in the city, and also in a number of schools in the city. And then I completed a fellowship with the Centers for Disease Control and Prevention in Atlanta. It was through the American Public Health Association. It was a fantastic internship if you ever get the opportunity to apply for it, where I received a great overview of many aspects of public health. I also interned with the New York City Department of Health within the Health and Hospital Corporation. I helped develop their Healthy Mother program, and I also worked with the Health and Hospitals Corporation and corporate nursing. And we were focusing on a study within Harlem, basically looking at young girls who were getting pregnant and trying to understand what the key factors were and if we could develop programs to help prevent pregnancy. My first real job after graduating with a master's degree was at Oxford Health Plans in New York City, where I was designing disease management programs. And I designed the programs, implemented them, and evaluated them with a team, a cross-functional team. And I was able to leverage all my public health skills, which is really exciting. And then I decided to try focusing in research and grant writing. So I was vice president of an organization called National Health Promotion Associates. And we wrote, I think we had 7 funded NIH, SBIR grants. They're called Small Business Innovative Research Grants. And we had some of them funded, which was really exciting. And we were working to implement the studies and the evaluation programs. It was really exciting. So anyway, I worked at NHPA for a number of different years until I left to try working at Pfizer to learn more of the business aspect of healthcare. I worked on a managed care strategic marketing team in cross-functional teams, and we looked at all the product portfolio, and it was really exciting developing a business strategy. So it was another angle of public health, and I worked there for about 7 years. I also love traveling. I've spent a great deal of time traveling throughout India, Eastern Africa, all over Europe, North and Central America. This picture here is one where we climbed to the top. We summited Mount Kilimanjaro in Tanzania, Africa, which is a little more than 19,000 feet high. It was freezing cold, and right after this picture was taken, I developed an intense migraine headache and just tried to lie down and take a little nap. And of course, everyone was all excited because they were worried that I'd never wake up. So they hurriedly picked me up and carried me down the mountain. It took us 6 days to go up and 3 days to get down the mountain. Last February, I organized a humanitarian trip to Cusco, Peru, with the goal of conducting a needs assessment in a rural village. And I'll talk about this later throughout the semester, but it was really exciting. We worked with a health clinic. We also worked with young girls who had infants who were homeless. The girls were homeless. They were between 11 and 15, and they had been, since getting pregnant, they were rejected from their villages, and so we were working with them in a home for young girls and their children. And we also worked in a special needs orphanage for a bit. Currently, as you view this, I think, I'll be visiting Prague, Austria, and Germany. My main goal is to visit refugee families in camps and in their new homes in and around Hamburg, Germany. I'm going to be working with one of my colleagues who I worked with in Thailand in the refugee camp, and just meeting some of the refugees and working on a campaign around fear and hope. I'll explain more about that later. So what about global health, public health opportunities in Jacksonville? Where are they? A great opportunity is the World Affairs Council, which is here in Jacksonville. It's a very active council, and they host global presentations each month here at UNF, at the University Center, actually. Our first presentation will be Tuesday, September 19th at 7 p.m. There's one approximately every month thereafter. There's one Tuesday, October 3rd, and Tuesday, November 14th. The presentation that we'll see in September is by Christopher Cox. It's entitled The New Global Economic Reality, How North Korea and Terrorism Play Key Roles. This should be really exciting. These are free tickets, and if you would like to go, I will be there. You can either call the number down below, 620-2117, or you can go online through either the World Affairs Council or on UNF's website through the Distinguished Voices Lecture Series. They're free tickets and they're really, really exciting. I'd highly encourage you to visit them. An organization that I've worked a great deal with over the past 7 years is Rethreaded, which is also located here in Jacksonville on Barnett Street. I'm not sure if you're aware, but Florida ranks second in the nation for human trafficking, and Jacksonville's #1 in the state of Florida. Last year, JSO rescued 55 survivors of human trafficking. 4 were minors. And 92% of the women trapped in prostitution say they would definitely leave if they could. So Rethread is an organization that helps these women. It provides them with skills and with a business so they can learn how to improve their self-esteem and learn a new trade. Another organization is World Relief in Jacksonville. It's one of the 3 refugee resettlement organizations. They have tons of volunteer opportunities. They're always looking for people to come in and help out with projects, and I'll have a number of projects I'll share with you throughout the semester. And what about global health opportunities in your area? UNF has many global study opportunities. There are many summer programs, there are relief mission trips, there are humanitarian trips, and for longer programs, Peace Corps, I'm sure you're familiar with, they have, it's a 2-year commitment. World Teach, the program that I was on, is a 1-year commitment. I've got tons of different ideas. If you're interested in spending time working abroad or volunteering in Jacksonville or around Jacksonville or somewhere in the country, I'd be happy to help you. So without further ado, thank you for listening to my presentation. I look forward to meeting you.